are given ciprofloxacin or rifampin as a way to prevent from even getting the infection. Right now, as I mentioned earlier, the CDC, the best way to prevent the spread of infection is just getting vaccinated. Right now, there are 2 vaccines that are currently available, and they're quadrivalent. And the first one is the Menomune, which has been available since 1981, and it's a polysaccharide vaccine that protects against serogroups A, C, Y, and W135. The second one that's used, and it's much newer, it's been available since 2005, is the conjugated vaccine, which protects against the same serogroups as ACY and W135. And Menactra is usually preferred over Menomune because it's conjugated to the diphtheria toxoid protein, which makes it elicit a better immune response. Menactra is currently used for patients ages 2 to 55 years of age. The Menomune should never be used, only in cases where Menactra is unavailable. And nearly 98% of patients who do get vaccinated will reach protective levels within 7 to 10 days. However, with this vaccine, there's rare reports of the Guillain-Barré syndrome, and as of right now, they're still being researched for the serogroup B vaccine because there's nothing available as of right now. So as far as how to control the spread of the infection, as I spoke earlier, the epidemic outbreaks are rare in the United States. However, we still get isolated cases in high school and colleges of someone dying. However, it's still a common problem around the world as far as epidemics. And the way that we are taught that not to spread the infection is by covering the mouth with tissue when coughing or sneezing. You want to wash your hands more frequently, because one of the ways of spreading the infection is by frequent touching. CDC recommends that the vaccination is the best method of controlling the spread of the infection. So some of the ways that pharmacists actually can get involved in this bacteria is actually counsel patients on medications they are taking and the side effects, whether the patient is infected with the disease or prophylactically with ciprofloxacin or rifampin. I don't know how often they actually administer vaccine patients in retail pharmacies. I'm pretty sure they don't. However, if there's any case, like as in the hospital, if they do administer the meningococcal vaccine to patients, just counsel patients on the adverse effects that's seen regarding the Guillain-Barré syndrome and what to look out for. And these are my references, and if you have any questions for me, I'll take them right now. Thank you.